Every radiologist struggles with the fear of kind of get sued for something not describing. You having practiced radiologist for many decades, how do you approach this fear of missing out important diagnosis? What's your advice to the young resident?
Well, the first thing I would say is to any young radiologist, accept that you're going to get things wrong. Obviously use the expertise and training you have to minimize the likelihood of getting things wrong, but it is an inevitable part of the human condition that we will not be correct 100% of the time. So if you accept that that's going to happen, perhaps the fear of it happening can diminish a little bit. Obviously, we don't want it to happen, and we want to do everything possible to avoid that. Then the next most important thing is to put yourself in the position of the referring colleague. What information do they need from us? Now, sometimes they don't necessarily make clear to us what the clinical scenario is that they're worried about, and that's a matter of communication. We need to improve communication with our referring colleagues so that we truly understand what question they're asking. But the key question we need to answer when we're reporting studies is the question that is being asked. If we have somebody with an acute abdomen, we need to know what their clinical findings are such that we can be directed towards what they're really asking us. If the clinical information they give us is inadequate, perhaps we need to seek a little bit more. Before we began this interview, I took a telephone call from a surgical colleague who had initially requested an abdominal CT with negligible clinical information. I sent that back to him seeking more. He telephoned me. We had a 3 or 4 minute conversation. Now I understand exactly what he needs. And of course, the scan will be done and tailored appropriately. That type of communication isn't happening as much as it should. And the fault lies on both sides, both that of the referrers and of the radiologists. We need to encourage that type of communication and make sure that we know what question they're asking.